Greetings, everyone. I'm Dr. Ali Danish. I'm an audiologist and a university professor. My research concentrates on tinnitus, hearing loss, balance disorders, and conditions such as hyperacusis and misophonia, and of course, vestibular disorders. I'm happy to share my work with you by preparing these videos. I hope you enjoy watching them.
Have you
Thank
ever
you.
wondered
See
why
you.
the simple pop of a balloon at a party can feel genuinely painful to some kids? Today, we're going to dive into what happens when everyday sounds actually hurt, exploring the really complex world of childhood sound sensitivity. Okay, so picture it, a classic kid's birthday party. You've got laughter, music, the happy chaos of a game. For most kids, this is pure excitement, right? But for some, that cheerful noise, the happy birthday song, even a single balloon popping, it's not fun. It's overwhelming, it's distressing, it's even painful. So what is really going on here? Well, this experience falls under a big clinical umbrella term, decreased sound tolerance, or DST. And here's the most important thing to get right away. This is not a child choosing to be difficult or just being too sensitive. This is a neurological phenomenon. Their brain is literally processing sound in a different way. Let's break down the two main ways this shows up. First up, we've got a condition called hyperacusis. And the easiest way to think about this one is to imagine it's a problem with the world's master volume control. With hyperacusis, sounds that seem totally normal to most of us are perceived with way more intensity, and it causes real discomfort. So it's not about disliking one specific sound. It's about the sheer loudness of pretty much all sounds being cranked way up. To get what's happening in the brain, researchers talk about something called central auditory gain. But honestly, the best way to picture it is just like this. The volume knob in the brain is stuck on high and you can't turn it down. The brain has essentially rewired itself to become too good at hearing, amplifying everything, and making the world seem incredibly, painfully loud. And this is way more common than you might think. Studies estimate the prevalence is somewhere between 3.2% and a pretty staggering 17.1%. Now, that's a wide gap, and it probably just reflects how hard this is to diagnose. But to put that into perspective, in an average elementary school, you could have dozens of kids who are struggling with this every single day. And the impact on their lives is huge. Imagine a noisy classroom, a bustling lunchroom, or a chaotic playground. All of those places can become just unbearable. This makes it so hard for kids to focus, to learn, and to build those social bonds that are so crucial when you're growing up. All right, now let's switch gears and talk about the second condition, which is called misophonia. And unlike hyperacusis, this one isn't about the overall volume. This is all about very specific trigger sounds. The word misophonia literally translates to hatred of sound. But here's the key. It's not all sounds. It's an intense, super negative reaction to very specific noises, these triggers, that are often actually pretty quiet and repetitive. And this analogy just nails it. We're not talking about simple annoyance here. For someone with misophonia, a trigger sound can flip an involuntary fight or flight switch in their brain, causing this immediate wave of distress or anger or even panic. And what are these triggers? Well, so often they're these everyday human-made sounds. The sound of someone chewing or breathing or sniffling, or even just the clicking of a pen can set off an extreme emotional response. So we've got these two very distinct conditions, right? But actually identifying them in children, well, that's a whole other puzzle for clinicians and parents. This slide gives us the absolute clearest way to tell them apart. For hyperacusis, just think loudness. A vacuum cleaner is a problem because it's loud. For misophonia, think pattern. The sound of someone chewing is a problem because of that specific repetitive noise it makes, even if it's quiet. Now, here's where it gets really interesting. Look at how these conditions overlap with other things. This chart is eye-opening. One study found that over a third of children with ADHD also had hyperacusis. That is nearly 3 times the rate of typically developing children. Wow. And this overlap isn't just with ADHD. We see sound sensitivities pop up very frequently alongside conditions like autism spectrum disorder, anxiety, tinnitus, and OCD. And this, of course, makes getting a clear, straightforward diagnosis even more of a challenge for doctors. A massive part of the problem here is just a lack of the right tools. I mean, listen to this quote from researchers Bagley and Hoare. They point out that the questionnaires and diagnostic instruments that we have were all designed for adults. So we're trying to understand a child's unique experience with tools that just weren't built for them. It doesn't really work. So if diagnosis is this tricky, what does managing these conditions look like? And maybe more importantly, where do we go from here? Let's look at a couple of really hopeful case studies for hyperacusis. Check out patient 2, an 11-year-old boy. After just 3 months of something called sound therapy, which basically just gently retrains the brain to get used to noise again, he was able to go to a birthday party. A simple activity that was probably completely impossible for him before. It just goes to show you that real progress is definitely achievable. The best path forward really seems to be a team effort. It usually involves an audiologist for hearing tests and sound therapy, a pediatrician to make sure there are no other medical issues going on, and a psychologist to help the child build some really crucial coping and relaxation skills. Now, for misophonia, since there isn't really an established cure, the focus is all on management. And therapies like cognitive behavioral therapy, or CBT, are showing a lot of promise. They help children learn how to manage their emotional reactions and slowly build up a tolerance to their trigger sounds. So, what does the path forward really look like? Well, there's an urgent need for diagnostic tools that are actually validated for kids. We need a lot more research into effective evidence-based treatments. And honestly, we just need to increase awareness among parents, teachers, and doctors so that a child's distress is recognized for what it is, a genuine neurological condition. And this all leads us to a final, and I think really vital question. This isn't just about treatment and therapy. It's about empathy. It's about accommodation. How can we, in our schools, our homes, and in our communities, start creating environments where every single child, no matter how they process sound, can feel safe, supported, and truly understood?